Today on Dueling Doctors, that's embarrassing. 3 humiliating health issues that almost everyone, including me, has had to deal with from time to time. Bad breath, dandruff, and excessive gas. What causes these problems, and more importantly, how can we treat them? Doctors from the world of holistic natural medicine and conventional Western medicine square off about how to end the embarrassment. And you won't believe what you have in your kitchen cupboards that can help these problems once and for all. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the world of holistic natural medicine and conventional Western medicine join us to debate and discuss the best ways to treat what ails us. Let's get started by introducing our guests. On the holistic side of the equation, with a medical practice that integrates naturopathic and Chinese medicine, is Dr. Serena Ma. And here with a more Western approach and weighing in with 28 years experience behind him in emergency medicine and a physician in the ER for all that time, I can't believe it, is Dr. Vinny Aletto. Welcome.
Thank you.
Our first topic today, excessive gas. Now, when you eat food, your body breaks it down and produces gas. It's normal to pass gas 10, 20 times a day. But for some, excessive gas can be painful and may mean that there's something more underlying. Now you know what causes it. How do you treat it? How do you prevent it? Each of our experts has up to 1 minute to present a treatment plan, and the other will be given an opportunity to respond to the other. We flipped a coin before the show, and guess what? You're up first, Dr. Aletto.
Okay. First thing I would do is take a history. History tells you everything. I want to know what you eat. I want to know when the gas is the worst. I want to know, are you a very nervous person? Stress causes a lot of gas.
So what foods particularly are you interested in?
Beans, the legumes, the carbohydrates.
High fiber foods.
Very high fibers, cabbage, those type of foods.
All the foods your mother told you to eat when you were a little kid.
Yeah, exactly.
So that's a good excuse for little kids not to eat because they don't want to have gas.
Right, and if you tell me you eat rice and beans 3 times a day, every day of the week, I'm going to tell you, listen, you need to stop here.
So dietary habits is very important.
Yes, that's the most important, okay. I would think. The next thing we'd have to really do is we have to consider some of the other things that have a more serious side to it. Irritable bowel syndrome, Crohn's disease.
Okay, so there are medical problems that are underlying that can give you excessive gas. Like you just mentioned, inflammatory bowel diseases like Crohn's, ulcerative colitis.
Yes.
Right. But that would also have other symptoms as well. You don't just have just gas.
Correct.
Right.
Correct.
All right, and then what else?
Some of the other things are, do you eat very quickly? If you eat very quickly, you swallow a lot of air.
So if you're shoveling that food in and you're not giving yourself a break, you're eating a lot of air as well.
Absolutely.
And then that air has to go somewhere.
Oh, it's got to go somewhere, up or down, but it's got to go somewhere. Right. So I myself prefer to have some mineral water with my dinner.
But doesn't it have like gas in it?
Well, yeah, but it helps you burp.
So you'd rather have it up front than down below?
Oh, yeah, not for nothing. Right. That's a bit embarrassing.
You think? You know, in some cultures, passing gas is actually a compliment to the chef.
Absolutely.
Not my mother's house, though. She would not be happy.
No.
Yeah, my father passed gas a lot.
Absolutely. We had to walk away from the table.
But there are also certain medications that can make you pass more gas. Obviously, we know that a lot of doctors prescribe antibiotics. That messes with the normal flora in your digestive tract, can give you a lot of gas, as well as some antidepressants. I know specifically serotonin reuptake inhibitors. I had a patient that was on Zoloft, had a lot of gas. He was very happy, but he had a lot of gas in the process. Nobody else around him was happy. But so that's your approach. Is there anything that you recommend as far as treatment if they're having gas?
I try to go first with the diet modification, and if that's not really going to help, and if you're not willing to change your diet, you got to go with some of the Mylantas, the Maalox, the Gas-X, the simethicone.
So the simethicone, which really just it kind of dissolves the gas.
Coalesces it and helps it to come out a lot quicker.
All right. Dr. Ma, you want to weigh in on what Vinny has to say?
I totally agree with Dr. Aletto. Take great history. A lot of times you're going to find out your answer there. I do also start with food as well, certain foods, as he mentioned.
So you want to take a diet history,
yes,
figure out what you're eating, and then what I do is I say cut back and then reintroduce elements of your diet and see which one it was that was causing it. Okay,
right.
that's what you
And
think.
sometimes we even, from a naturopathic approach, will just cut back not one by one, but a whole group all at once. Perhaps they
like
work
dairy and fiber and
dairy and fiber. One of the things.
So withdrawing some of the food products that have high fiber or even dairy, and then slowly introducing them back in and see which causes it.
That's one approach.
Okay.
Sometimes I like to take a whole slew of problematic foods out.
Okay.
Dairy is one of them. You've probably seen the gluten craze too.
Yeah, it's everybody has a gluten sensitivity, they're lactose intolerant, and then I think, do they really know, or are they just saying that? I guess that's your
I would
approach.
say the majority probably are just saying that, but there are people who really do have these issues.
Okay.
One of the other things I practice is acupuncture and Chinese medicine. And from that standpoint, digestion is controlled by spleen qi, or spleen energy.
Yeah, so the spleen has its own qi?
Yes, it does.
Does every organ have its own qi?
Not every organ, but
Spleen's special.
the spleen is special.
I would have never thought the spleen was a digestive organ, though.
I know, you wouldn't think
No.
that. It's actually misnamed,
Okay.
but actually when I talk about spleen, I'm talking about the pancreas.
Oh, which has all the enzymes that are used for digestion.
Right, exactly.
Okay.
They just misnamed it somehow and got mistranslated. So
Okay, so acupuncture, and even after one session, you can get rid of the excess, gas?
it's possible. So one of the things I really want to go back to is the diet, looking at foods that are higher in fiber. One of the things that's, if spleen qi is deficient or weak. It's not able to digest food as much
So
as
what
well.
would be better, cooked food or raw food?
Definitely cooked food.
Really? I mean, there's all this raw diet
I know,
craze.
I know.
So if it's cooked, you're actually softening it and preparing
Exactly.
it for digestion.
The heat helps to start, the heat starts to break up some of those bonds.
Okay. Now, what would you prescribe your patients that they could buy maybe at a supermarket or a specialty supermarket that they can eat to help with digestion?
So one of the
excess
first
gas?
things that's kind of like a quick fix, like if you're out on the go, are fennel seeds.
Oh,
You've seen them
that's right
everywhere.
there.
It's right here. You see them at the grocery store in
let
your
me see
spice
those.
aisle. We cook with it. But
Nice.
just
You've seen
one
these
of
before?
my
One of the things is in the Mediterranean, they use those all the time. Sambuca with your
It's funny
your
how you didn't
espresso.
mention that 2 minutes ago when I asked you about
Well,
it.
she takes a very holistic approach. She reminded me.
All right, so you think fennel, because it's a
Fennel
carminative, that
is
will
a-
help reduce gas.
Right, a carminative will help your body release gas. So that's one approach. It's a quick approach. Another approach that I would take is to help your body digest better, to add that spleen qi energy back, whether it's by stimulating digestion. One of the first things I ask my patients to do is to put a little squeeze of lemon.
So lemon's going to wake up that spleen
Right.
and put it to work.
It's actually the acid is going to kind of remind the stomach to start producing stomach acid, which
Okay, which helps with
in turn
digestion, right.
kind of turns everything on. Half a lemon squeezed in water
Just in
before meals.
Water, before the meal.
Another
and
idea is bitters,
bitters, and then you can also use that
and
as well.
finally digestive
All
enzymes.
right. Thank you. That was a lot of great information, and at least we can come to an agreement on one thing. We have to take a break. Up next, is the dandruff you're dealing with no big deal, or is there actually something alive and growing on your head? Find out how to tell and how best to treat it next. Welcome back to Dueling Doctors, the show where health experts from the world of holistic natural and conventional Western medicine debate the best ways to treat ailments and illnesses that affect us all. Today's theme, that's embarrassing. We're joined by holistic Dr. Serena Ma and our Western physician, Dr. Vinny Aletto. We've already debated the best ways to treat excessive gas. Now it's time to take on dandruff, those embarrassing white flakes that can literally make your skin crawl. Now, dandruff is simply dead cells exfoliating off your scalp. Chronic dandruff can lead to a dry, itchy, flaky scalp and could be caused by a fungus called malassezia. Each of our doctors has up to 1 minute to present a treatment plan, and then we'll debate the pros and cons of each. Dr. Vinny, you went first, so please let's have ladies next. Dr. Sridhar, please.
As you mentioned, dandruff could be caused by a yeast infection on top of the scalp. So one of the first things we think about as a natural antifungal is tea tree oil. It is irritating on the skin, so you don't want to apply this directly.
So how do you recommend we use it?
I recommend either
this.
diluting it into your shampoo. So
Whoa.
it's stinky. It's a,
So you mix how many parts to how many parts
so
of water?
I would just actually I would suggest putting into your shampoo.
Oh,
So
like
whether
a mild shampoo, you add it to it.
right, I would say maybe 5 drops per ounce of shampoo,
Okay.
or if you have like a little bit of shampoo daily, you could just add a couple of drops to that, and then just use that as your shampoo.
And you would recommend doing this every day?
If needed, yes, every day.
Wow, is that not abrasive to your skin if it drips down? And
If it's well mixed into your shampoo, it should be fine, especially
okay.
at just 2
All right.
drops.
What else do you have?
So what else do I have? Another thing that I have is
those glistening jewels.
those
of,
glistening jewels of fish oil. They package them well, don't they?
They package them well because you know if you break one open.
Oh, that might not
These
smell so good
also
either.
smell delicious too.
So fish oil is to address the inflammation. As we know, fish oil, omega-3 fatty acids are good for so many things.
True, especially triglycerides if you ingest this. So if you're saying that if we ingest some omega-3, it'll help with my scalp.
Omega-3s helps with inflammation, and as you know, the infection is causing an inflammation of the scalp. So,
So not all dandruff is fungal. I mean, it can just be your exfoliating skin. But
could
at
be.
times, it can be so chronic that it would force fungus to grow, especially if the oil glands, they're attracted to the oil glands on your hair follicles.
And then I would address the diet. Fungus thrives with sugar.
Sugar, so cut back on sugar.
Cut back on sugar, cut back on
And what's in
alcohol.
that?
Did you know that hair has a pH of 4.5
No, I
to
did not know
5.5,
that.
which is acidic?
This is vinegar.
This is vinegar. That's apple cider vinegar. You
I
can
like
buy
vinegar.
at.
Oh, vinegar's good.
The thought is a lot of the products we use, shampoos, hairspray, bring our scalp to more of a basic non-acid environment, which can make fungus thrive. So bringing your scalp back to a more acidic environment, so using like an apple cider vinegar wash.
Could you mix it with tea tree oil?
So
or?
what I would suggest doing is put your tea tree oil into your shampoo, and then after you rinse out, do a vinegar rinse. Mix 1 part of vinegar with 1 part of water, and have that as a rinse. Keep that in your hair for about 15 minutes, and then you can rinse it.
All right, Dr. Vinny, help me out. I have bad dandruff. I go to board meetings. I'm humiliated. I mean, do I need to do this, or what do you recommend?
How often do you shampoo?
Well, that's a good question. Should I be shampooing every day?
Everybody has a different chemistry. They need
Well, we're talking to me.
to find.
I get it.
Yes.
Because if you're working like in the street and you're working in a coal mine, yeah, wash your hair every day.
Absolutely.
But I go from an office to an apartment. Do I really need to wash my hair every day?
Some people don't.
You recommend daily cleansing of the
I
hair?
recommend daily cleansing.
And then what about for dandruff if it still continues?
There are some things in the diet. There's zinc, there's B vitamins that you might have to supplement your diet
So
with.
supplementing your diet.
Right.
But what about a dandruff shampoo?
Then I think you can try Head and Shoulders, you can try Selsun Blue, any one of
Because
those.
selenium, we know, is an
Right,
antifungal.
it's an antifungal.
And it works really well.
But
So a
not
lot of
all-
these shampoos that you're mentioning, the fungus can grow resistance to it, and in it itself can be irritating to the scalp.
So the Malaysia is like, yeah, go for that Selsun Blue, because then we're going to get bigger and stronger.
And we're going to get stronger.
Right.
But I mean, that's why I think you shouldn't use it every day. In my opinion, I think you should use it periodically. Your fungus won't develop
Right,
resistance
right.
to it.
Exactly.
All right. This is a great idea, and I might try this. I don't want to get any abrasions on my head, but Selsun Blue is like my go-to. All right. Thank you all. That was great information. We're going to take a break, and when we come back, one of the most embarrassing and most common ailments, bad breath. You might be surprised that something almost all of us eat causes it. Plus, I'll show you a simple trick to test your own breath. We'll be right back. Welcome back to Dueling Doctors, our That's Embarrassing edition. Time to talk about one of the most embarrassing problems of all, bad breath. Now, bad breath typically originates from poor oral hygiene, and I've got a simple test for each of you on how you can tell whether or not you have bad breath. It's called the gauze test. I'd like you to take your piece of gauze, please, and then I want you to wipe your tongue. All right,
Cotton.
and then smell it. I smell
Not bad.
Get at it.
Oh, God.
Let me smell
You don't
it.
want to do that, man.
No, I don't.
Yeah, I told you.
Okay, each of our doctors has up to 1 minute to present a treatment plan. Dr. Vinny, tell us about bad breath.
Bad breath is mostly caused by poor oral hygiene. That's bottom line, is you need to see your dentist, you need to see if that's the problem. There are other things that
So
do
wait,
cause bad
poor oral
breath.
hygiene. Like, so what do I do?
Well, you need to floss, preferably after every meal. You want to get those. You want to get that out. You can carry little toothbrushes with you. You know, they have all
Oh,
these
did
really
you bring
neat
your pink
little things.
toothbrush with you
Yes,
today?
I did.
Let me see that.
Pick it up at any pharmacy, and you can get any one of these little products. I mean, you carry these around
You mean
with
toothpaste
Yeah,
products,
Any
okay.
one of these, the mouthwashes.
So your regimen, flossing,
Is pretty much
brushing,
flossing.
and mouthwash.
Yeah, yeah.
Okay.
And there's other things that one could have, chronic sinusitis,
So
polyps.
post-nasal drip
Post-nasal drip will do it.
could give you bad breath.
Tonsillitis will do it.
Tonsillitis.
In medicine,
which is
well,
inflammation
of the tonsils,
possibly due
strep
to an infection. Strep,
and
which is a bacteria.
In medicine, we have a lot of characteristic smells, and tonsillitis smells like something crawled in and died there. I mean, it's a horrible smell. I tell moms, Mom, you got to smell this. And they actually reel a bit. Just a little funny, but anyway. But
Are you concerned that mouthwashes dry out your mouth?
a lot of them do contain
Serena, Ma.
alcohol.
I mean,
Right.
don't they have?
Sugar.
What do they have in there?
Yeah.
And plus, that bright blue color scares me. I mean, what's making it that bright blue?
Let's read it. But no, seriously, there's a lot of alcohol
Yes, there's a
in
lot of
some
alcohol in
mouthwashes,
them.
which actually do the same thing. They dry out your mouth, and we do know that dry mouth
Can cause.
is one of the problems that can lead to problems in
Absolutely.
the oral cavity,
Absolutely.
because that's where sulfobacteria can grow. My concern is that touching base on the toothbrushing, you're really looking for retained food particles.
Yes, you are.
Which is why you need to floss all the time, at least 3 times
Absolutely.
after every meal. And for some people, I don't know about you, but I've looked in people's throat. You just mentioned the smelly tonsils. Don't you ever look back there and you see retained food particles?
Oh, absolutely.
And I take that little Q-tip and I'm like, I know what you had for lunch today. I mean, it's not only going to go away with brushing your teeth, but there are also some medical problems that can also cause that.
Yes,
there are certain
Sjogren's disease,
which is dry eyes, dry mouth, arthritis.
All the mucous membranes.
It's a rheumatological problem.
That's correct.
It's not very common, but
No.
it could mean. And also
Absolutely.
certain medications.
Medications.
Antihistamines. You mentioned
It's a big one.
sinusitis.
It's a big one.
Big side effect is dry mouth, and you have to be careful. A lot of antidepressants and antipsychotics cause dry mouth. You can see it. Dr. Ma,
Right.
what do you have to say about this?
Sometimes I meet people and they have the best hygiene, brush their teeth,
Why,
floss
thank
their. Yet they still have the bad breath.
I don't like
So
it.
again, it's working with digestion. The mouth is just the opening of our digestive tract. So there could be something fermenting down lower. So anything to improve digestion can be helpful. And one of the things that I found really, really helpful with my patients is chlorella.
Chlorella. Now that
Chlorella.
is algae.
It is an algae.
Okay.
It's mostly chlorophyll, but it has a lot of other vitamins and minerals on top of that. It's seen as a big detoxifier.
So how do you take it? How does it come?
I recommend
Oh.
it comes in powder.
And here it is.
And look.
Oh, so it's actually green like chlorophyll.
It is, it is. So
see.
these are tablets, but you can also find chlorella as a powder and to mix with water and to drink it. But I find the tablets much easier to take.
So you take this how many times a day?
I've had people just take one tablet twice a day of the chlorella, and it has killed chronic bad breath.
You know, one of the other things you have to realize is the excretory tract isn't just the urination and defecation, it's also breathing. A lot of the foods we eat, actually, when they get metabolized, they go through the bloodstream into the lungs. We give them off in vapors.
Right.
And that's another cause of halitosis.
Well, definitely what you eat is a problem. Besides chlorella tablets, what else do you recommend?
So there's a lot of, like if you do want to go for the mouth rinse idea, maybe
Typically
something
non-alcohol based.
Non-alcohol based. There are mouth rinses on the market. You can either make your own with herbs such as calendula, marshmallow root. These are all herbs that are anti-inflammatory.
What about zinc chloride? Could you use that as well as a mouthwash? Not because that really would reduce the sulfa.
You could. That's a good
So
idea.
what did you say? Calendula?
Calendula is an herb
right.
that's found in some mouthwash formulas. It's anti-inflammatory. You've probably seen it like as body lotion and all that
Okay.
kind of stuff.
All right.
baking soda.
Baking soda
Right.
as well.
Baking
Most
soda.
bacteria is acidic.
My mother loved using
And my
baking
favorite
soda.
thing is probiotics. maybe some probiotic
I think that's
lozenge.
one of the only things you need to have in your house at all times.
Yes.
Well, you guys were just really great. I learned a lot today. I hope you did too. I want to thank you both for joining us and for having good breath, healthy scalps, and at least for one of you for not passing gas. You know who you are. Anyway, we'll be back. Welcome back. We're in the home stretch of our That's Embarrassing episode. And whether you suffer from excessive gas, dandruff, bad breath, or all of the above, the bottom line is that there are a lot of options available. Don't be embarrassed to bring these up with your doctor because it may be a sign that something more serious is going on with you. Here's my spin. For the most part, these problems are the body's way of functioning naturally. For excessive gas, cut back on high-fiber food and then reintroduce them slowly to see if you can point which one is the culprit. For dandruff, keep the scalp clean. I recommend using a dandruff shampoo with selenium, but not every day. For bad breath, good oral hygiene, brushing, flossing, and using a non-alcohol-based mouthwash. And remember, the two biggest offenders in your kitchen right now are coffee and cheese, my favorites. I'm Dr. Frank Spinelli. I hope to see you soon on Dueling Doctors for more healthy discussions as you explore the best path for your own personal prescription. And as always, be sure to talk to your healthcare provider before making any medical decisions. We'll see you next time.